welcome back. We're going to dive straight back into it. Colette, how is Freelite being used?
Okay, so Freelite is primarily used for diagnosis and monitoring of monoclonal gammopathies, and that includes things like multiple myeloma and AL amyloidosis. So perhaps some things to tell you are there's been some recent publications that have supported a new diagnostic algorithm for query myeloma tests. And that's basically to add Freelite to serum protein electrophoresis that's done instead of adding the urine tests. A couple of reasons why this change. One is to do with the lack of patient compliance in supplying these urine samples. You can get up to about 50% of cases where the patient doesn't supply the urine. And what that means is that in those cases only serum protein electrophoresis is being done. And the other reason is there's quite a lot of evidence that says that if you add Freelite instead of urine, then you can get detection of more patients and detection of those patients earlier.
Okay, and amyloidosis?
So, Freelite chain testing utility in amyloidosis is really quite well established, but there's been quite a lot of interest recently in using Freelite to make sure that you get earlier diagnosis of those patients, because there's quite a lot of benefits when that happens. Perhaps the last thing to talk about is in the area of all these new therapies for things like myeloma. What we're finding is that patients are getting to much deeper levels of response, and Freelite's ideal then because it's a sensitive assay. And you can detect down to these lower levels of monoclonal proteins that we now find. And that means you can continue to use an assay like Freelite before you have to move on to the more sensitive and, to be fair, more expensive minimal residual disease tests.
Perfect. Thank you.